Very happy you could be here this morning. I'm here with my colleague Kathy Bennett, Minister of Finance and Minister responsible for the status of women. And to my left is Mr. Ian Tucker, who is a solicitor within the Department of Justice and Public Safety. As committed earlier this year, I'm pleased to announce that we are moving forward today with legislation to allow for the creation of safe access zones around healthcare facilities that provide abortion services. The Access to Abortion Services Act will be introduced in the House of Assembly today for debate. This proposed legislation will also allow for the creation of safe access zones around the homes of health professionals and clinic owners providing abortion services in the province. While there is currently a 40-meter buffer zone established by the Supreme Court Trial Division for the Athena Health Centre, the legislation we are bringing before the House will allow for the creation of safe access zones around other facilities if the need arises. The intent of the legislation is to balance the rights of some to protest or express dissent with the rights of others to secure, private, and respectful access to legal health services. Women in our province are entitled to health care, including abortion, which is a legal medical service. Access to medical services is fundamental to our health care service. Those who use health care services and provide services should be treated with dignity, courtesy, and respect, and should not feel intimidated or fearful. Equally so, those who choose to protest should have the right to do so. This legislation is not about preventing peaceful protest. The proposed legislation will allow for such protest outside of a safe access zone. Many demonstrations that occur in this province are peaceful and respectful in nature. However, unfortunately, that is not always the case. Abortion protesters have actively attempted to discourage women from seeking abortion services at a particular clinic here in St. John's. The owner of that clinic has been confronted outside the clinic while attending to personal family matters. Such encounters are certainly not unique to this province. British Columbia enacted similar legislation in 1996. In drafting the Access to Abortion Services Act, we have looked to this legislation from British Columbia. It provided a useful guide for our province as we determined various aspects of the legislation, such as the proposed distances for safe access zones, potential locations, and very importantly, ensuring an appropriate balance between the right to protest and the right to access health services. The legislation proposes a safe access zone of up to a maximum of 50 meters around healthcare facilities. The legislation proposes a 160-meter safe access zone around a doctor's residence and 10 meters around a doctor's office. The proposed bill will prohibit people from conducting the following activities in an access zone: engaging in sidewalk interference, protesting, besetting, physically interfering with or intimidating service providers, doctors, or patients, photographing, filming, videotaping, sketching, or in any other way graphically recording a service provider, doctor who provides abortion services, or a patient while in the access zone for the purpose of dissuading them from providing or using abortion services. In addition, inside or outside a safe access zone, a person is prohibited from repeatedly approaching, accompanying, or following a person, or engaging in threatening conduct for the purpose of dissuading another person from providing or using abortion services, repeatedly communicating by telephone or any electronic means with another person without their consent for the purpose of dissuading them from providing or accessing abortion services. The proposed legislation allows for a person to recover damages if the law is broken. There are penalties proposed for contravention of the Act. For example, a person can be fined up to $10,000, jail of up to 1 year, and possible conditions of a probation order. These proposed penalties are again modeled after the BC legislation, which has successfully been in place since the mid-90s. In addition to looking to establish legislation in British Columbia, our department also sought input and comment from various stakeholder groups to help inform the development of the legislation. We were pleased to gather input from healthcare organizations and professionals, the women's community, policing agencies, Ms. Lynn Moore, the St. John's lawyer who is very familiar with this issue through her work to establish the current 40-meter buffer zone, as well as pro-life advocates. I thank them all for their input, their expertise, and their insight into this very important matter. We're looking forward to bringing this proposed legislation into our House of Assembly today, and I look forward to debate and questions from members over the coming days. And now at this time, I'm going to turn it over to my colleague.
Well, good morning, everyone. I am very pleased to join with my colleague, Minister Parsons, today to outline details of this important new bill, the proposed Access to Abortion Services Act. As Minister Parsons has stated, this legislation will allow for the creation of safe access zones around facilities that provide abortion services. It will also allow for safe access around the residence of offices of the doctors and other people who provide or facilitate the provision of abortion services. There is no doubt that there are differing views on the subject of abortion in our province and certainly across the country. However, it is important to remember that abortion is a legal medical service in our province, and access to medical services is fundamental in our healthcare system. Abortion services must be available to women in an atmosphere of dignity and respect. This legislation is very important for women. As Minister responsible for the women's policy, I am very pleased to support a woman's right to safe access to any service that she chooses. A woman should not be subject to intimidation or invasion of privacy based on a personal choice of her making. This is about safety, and I support any action that ensures a woman feels safe and secure in accessing any service that she feels is right for her. In addition, doctors and other service providers must be able to provide these services in a safe and respectful environment without threats, intimidation, or harassment. As Minister Parsons has noted, many demonstrations that occur are peaceful and respectful, but unfortunately, that is not always the case. This legislation is a proactive approach which allows for the creation of safe access zones around facilities that provide abortion services if the need arises. Input on the proposed bill was sought from various groups and individuals, including the Provincial Advisory Council on the Status of Women, the province's women's centres, and Pro-Life NL. The intent is to ensure a balance of the rights of individuals to secure respectful and private access to legal health services, with the rights of others to protest and express their opinions be respected as well. Again, I'm pleased that we are proceeding with this legislation today. Thank you.